Government officials in many parts of the world are breathing a sigh of relief as the Omicron BA.1 surge is over. As the pandemic persists, the good news is, at least now, there are new effective treatments and plentiful tests and vaccines. But then there's the bad news. The Omicron BA.2 strain and its descendants are becoming dominant, and immunity from infections and vaccinations are waning. One expert reminds us that the pandemic is not over, and governments must be prepared for whatever comes our way. I speak with Javier Guzman, the Director of Global Health Policy at the Center for Global Development. Javier, good to see you. We'll do the COVID way of doing things, and we'll head on in here and we'll have a nice conversation.
The center is an independent, nonpartisan institution that works to reduce poverty in developing countries. I met Dr. Guzman at our studios in Washington, D.C.
So give us a picture today of where we are with global vaccinations. There's been so much talk about, for the longest time it was income inequality. Now it's vaccine inequality. Some parts of the world are doing pretty well, others not so much. You have a clear read on this. How would you describe it today?
The vaccine development was the fastest ever in history. So 11 months. We're not talking about years, but months. And we have, over 11, WHO pre-qualified vaccines, different platforms, different manufacturers, different countries. So that is amazing. On the positive note as well, the world used to manufacture 5 billion doses of vaccines per year for all the childhood vaccinations, 5 billion. Last year, the world manufactured 12 billion doses of COVID vaccines, only COVID vaccines. So ramping up manufacturing was extremely successful. And also, if we talk about rollout, you're asking about the current state of vaccinations, high-income countries, upper middle-income countries were able to vaccinate, 40% of their populations within, 11 months. So that was pretty remarkable. So that's been positive. And of course, we cannot deny the negative side of, the equation, which is all about vaccine inequality. And that has to do with how low-income countries and lower middle-income countries have not been able to vaccinate their populations. First, because of supply. So first, because vaccines were not there, but then because problems with the health system, problems with financing, problems with, human resources. And the problem now, as we speak, is, those low-income countries do not have more than 10% of their populations fully vaccinated. And that is, a huge gap between the haves and the have-nots. What we see now is big disparity with some successful stories and some really negative, realities on the ground.
Dr. Guzman served as the technical director at the global nonprofit Management Sciences for Health. His work helped over 20 governments in Africa and Asia build up their health systems. Before that, Guzman worked at the Ministry of Health in his native Colombia.
It seems to me, in the United States, you might be doing a good job of ramping up vaccines for everybody. But we've seen that we live in a global village, in a sense, because you start to see a variant cropping up in South Africa, and it's not long before it's in Europe, and then it's not long before it's over here. I mean, we keep seeing this over and over and over again. So if you're talking about communities and countries where there's very low vaccination rates, the new variants can kind of percolate and spread. They're not going to stay confined to that area, right?
You've said it. I mean, we've seen it. I mean, it's not something that we are thinking about as a possibility. It is a reality, and we've seen it. And to be fair, the problem is not vaccines anymore. The problem is not supply anymore. The problem is actually turning vaccines into vaccinations. And that is difficult. One, because health systems in a lot of the low-income countries are not there. Two, because human resources are not there. So a lot of investment and a lot of work is needed for these health systems to vaccinate the populations. But also there is vaccine hesitancy. And vaccine hesitancy because when they wanted the vaccine, they didn't get the vaccine. The vaccine was not there. And now that they've seen, oh, we've had it, a lot of people, more than 70-80% of people in low-income countries have had COVID. So a lot of people are thinking, well, we just didn't die, or those who did die, well, have already passed away. So what's the incentive now to get vaccinated? And of course, there is this thinking that, there's some lack of trust in Western countries or Western institutions in terms of we failed in the past, and that had an impact on the perception of vaccines and the perception of being wanting to be vaccinated, and of course the natural immunity, and of course having other problems like HIV is there, malaria is there, other diseases are there, and as we were saying, food prices and inflation and economic stagnation.
How do you address these challenges? Because they're all kind of sort of bricks on top of one another, creating this wall that's creating a big problem in terms of like overcoming this COVID, basically.
But one of the big lessons that we've learned, or we should learn, is adequate financing, timely financing is essential in responding to something like COVID. So Western countries were able to sign contracts at risk in 2020. No vaccine had been developed, no vaccine had been registered, and they signed advance purchase agreements. So basically they signed contracts at risk. And therefore they were able to get vaccines early on in the game. Middle-income countries, low-income countries, COVAX donors, financing institutions for low-income countries didn't actually make any commitment or didn't actually make any funding available at the right time. So there were COVAX and a lot of countries were negotiating these agreements after the vaccines were registered 6 months later. And that basically meant a huge gap in terms of, one, of course, the queue, but two, the ability for the private sector to have clarity on demand and to ramp up vaccine manufacturing actually faster. But the second one is we had geographical concentration of suppliers. We relied on very few firms and very few countries. And that was good in terms of price and volume, very efficient. But we saw how, of course, countries had to address their own needs first. And you, of course, saw export bans. You, of course, saw problems with raw materials. And therefore, there needs to be more diversification of vaccine manufacturing. And you see now a lot of countries and the US government and other governments, talking about tech transfer, talking about creating, vaccine manufacturing plants. But the problem there is that's great, but we want this to be sustainable.
You've talked about the challenges out there. You've addressed them very nicely.
Clearly, we failed as the world working together to address this issue in terms of being able to have this sense of unity, this sense of nobody's safe until everyone is safe. Low-income countries, a lot of countries feel that this is just nice words. There's no substance there. Clearly, because they were not part of the decision making. If you look at the COVAX mechanism, all decisions being made in Switzerland. If you think about the regional platforms, the African Union, or if you think about all those platforms were not at the beginning functional and were not embedded within the system. So now a lot of conversation is about regional response, regional approaches, or national response, national approaches. But the question is, how can we modify the global health architecture So it's more inclusive. So people do have a voice and can be part of the decision making. And these things are not just, countries doing, their own thing. And it's a common problem, I guess, because this is beyond, COVID. And this, you see that in a lot of problems that are, of global nature.
Announced in June 2021, the World Health Organization set up a global mRNA technology transfer hub in South Africa. The effort was made to support COVID vaccine development in low and middle-income countries. Currently, Africa, a continent of 1.3 billion people, only produces 1% of its vaccines.
Well, let me ask you about the different approaches to COVID. I've spoken to one expert who said, the problem is, it's putting all your chips on one item. Like we're going to put all our chips on vaccination. We're going to put all our chips on strangling the virus. Whereas you need to have your chips across the board. And one of the things that this person mentioned was that antivirals, and you brought it up, that it doesn't seem like people have put that really into the mix as much as they should have. You should have an overall approach. Do you agree with that strategy?
Very much. I mean, we should be talking about a toolbox. A toolbox of medical countermeasures and, of course, a toolbox of policy actions. So back to your point, in terms of these vaccinations, well, were never a silver bullet and should not have been considered a silver bullet. Everyone knew that this is an evolving threat. I mean, viruses do evolve, and from the get-go, experts knew that there would be variants, and experts knew that there would be escape to the vaccines. So the toolbox is needed in terms of not just vaccines, but diagnostics, but oral treatments, but also oxygen. So clearly, there's a need to be more balanced in terms of the approach. Now, you said something about vaccination in the United States. It's been plateau. It's been 65%. It will not increase. So clearly, you do need to have other measures in place to be able to respond. And the ability to test, the ability to treat, the ability to identify those with the highest risk, being very targeted is very important.
In mid-May 2022, Argentina's health minister announced the country was entering a fourth wave, following a 92% jump in COVID infections from the previous week. With a population of 45 million people, Argentina has recorded 130,000 deaths since the beginning of the pandemic. And South Africa, one of the countries hardest hit by COVID, entered its fifth wave of infections in late May. That's despite the fact that an estimated 97% of its population have antibodies from previous infections or from vaccinations. South Africa has recorded 100,000 COVID-related deaths since the start of the pandemic.
When we think about medicine, oftentimes we think about patients, but you're on another piece of this, which is policy, which is even more important. Talk to us about policy. How do you move it? I mean, we've talked a little bit about COVAX. A lot of people don't even understand what that is. But from a policy standpoint, it's really hard to kind of get the mechanisms in place, isn't it?
Well, I guess it's all about, the governance arrangements, and it's all about, the architecture overall. And that requires time. Of course, we all based on the multilateral system and the UN system, but there are just so many new players. For instance, COVAX, you mentioned COVAX. Clearly, that governance arrangement was not fit for purpose because it didn't have the voice of a lot of, the low and middle income countries, because the decisions were very centralized in a single place in Geneva, because the regions, the platforms, were not used at all. So therefore, I think there's a lot of thinking needs to take place in terms of the best governance arrangement, leveraging the multilateral institutions, by making sure that people do have a voice and do have a way to make decisions for their own future.
Is it harder being in the policy arena versus the operating room or in the hospital where you're just dealing with just one patient?
Well, I think it's hard. It could be hard. It could be seen as harder, but it's also more rewarding in terms of being able to impact, population, the health of a population rather than a single individual. But I think there's the need to have these policy conversations at all levels. For us to understand what the implications are for the different policy options, right? Governments do need to make decisions, and citizens need to understand why decisions are made. So the policy space is a space that is very much needed to feed back into the citizens, the governments, and be able to move forward.
Let me close by asking you this question. We've seen so many different waves, so many different variants, and clearly, it's like a tsunami. It just keeps coming, and it's huge. What do you see in future waves of COVID, and what should we be keeping our eyes open for?
Well, I think it's interesting. You said already said that there will be future waves, and that is the first message. I guess the first message is we will have more waves. That is a reality. I mean, this conversation about herd immunity and we will all eradicate the virus is just not going to happen. So yes, that will happen. Probably, we will have more waves than influenza. So it might not be once a year. We might have a couple of waves. Small waves, each year. We will have second-generation vaccines where, we might actually be able to vaccinate once a year, probably. But again, we might need to vaccinate twice a year. Antivirals will be very useful to be able to address these new variants. Hopefully, the new variants will not be more severe. Probably will be as contagious as the variants we see now. But of course, if you are part of the population with, risk comorbidities or with some health risk, that is, those populations are the populations to care for and to look after, because those populations are the populations that will suffer the most. So those are the populations that should be vaccinated as soon as possible. That should actually be properly treated as soon as possible. But this is going to be with us for the foreseeable future, and that doesn't mean that we should just keep hoping that it will go away and keep living as if it's not with us. I think it's better to just be prepared for what's coming and do our best. And that's just, I guess, my reflection of what the past 2 years, have taught us, but also what the future is looking like.
Dr. Guzman, thanks so much.
Thank you very much for having me.